Okay, so you have me back for a few seconds here. I'm going to introduce our next speaker. I'm really pleased to be able to introduce Ron Dembo as one of our speakers today. We've talked a lot about applications, cool applications like Instagram, and I will have to say, is the lady from Instagram still here? That Hyperlapse app that you guys have now is super cool and is probably the thing that will finally draw me to start using Instagram a little bit more. But one of the things that always strikes me, we talk about applications and sharing information, Facebook and Twitter, which is kind of more of a personal sharing forum. And we've talked about in previous conferences, well, how do we take that personal social media lessons and apply it to government? Government tends to be very transactional. Give me a permit, give me a marriage license. It's all about, give me information. And then sometimes government uses these tools to communicate in more of what I would call a one-way sort of news feed thing. Like, we have this page and we're just going to push information to you, but it isn't really real-time two-way communication. So I'm fortunate to participate in a lot of different groups, and I met Ron a number of years ago, and I think he's a real thought leader. And I had the good fortune of running into him recently. He was telling me about this new initiative he has underway now. I'm happy to have him here talking to you about it today. But to me, what it really struck a chord in, one of the things I always wonder about is, okay, we talk about Wi-Fi, we talk about tablets, we talk about apps, but why do people want to be connected? And ultimately, how does it benefit them? How does it benefit our communities? How does it benefit society? How does it benefit the individuals? How do we make it more about just a single transaction, about every year I want to pay my property taxes? Very important transaction, but a very singular transaction. How do we take all this and integrate it into our everyday lives and really benefit from it in a meaningful way? So with that, Ron, if you'll come up and talk with the group.
Thank you. Well, it's wonderful to be here. Thank you, John. I really laughed early on when Nikki was talking about what the world was like before her time. Before my time, there weren't computers. So just to date me. I'm going to start this talk with a couple of wicked problems. Those are problems that are hard to solve. And they affect the world, but they also affect San Mateo County. And I'm going to talk about, how we might tackle those problems. So, for example, very current now, if you were in New York or any of the other major cities, you'd be talking about 4 degrees, which is more or less where we think the world will go to if we keep on pumping carbon into the atmosphere. So what do we do about that? In San Mateo County, it means that a lot of flooding will occur, and probably we'd be underwater now. That's no joke. It's actually pretty real. I just came from the South Pacific, and a lot of islands there are actually disappearing. There's other amazing statistics. The World Health Organization came out with a number this year that really got a lot of people thinking. 1 in 8 people in the world die because of air pollution. It's a bit scary. It's also about almost 10 years ago, Forbes put out an article that said that there's 1.6 billion people who are overweight in the world, and in 10 years, that's almost now, that will grow by 40%. And that is happening. You can actually see it. If you look at maps of the world, you know where that is already happened, and the big red splotches means a very large proportion of overweight people. Now let's get to San Mateo County. These are statistics that I picked up. 1 in 3 children in San Mateo County are designated overweight or obese. In South San Francisco, which is a part of the county, it's 1 in 2. So this is truly, a nation in need of rehab. Now, San Mateo County is a lot better than many counties in the U.S., but still, with all the wonderful things that are happening, and there are plenty of them happening, we have problems here. 1 in 3 San Mateo children don't meet normal fitness levels. In South San Francisco, it's actually 1 in 14, which really amazed me. So clearly we need some way of motivating change. Shows my age again. 2/3, I'm now talking about Canada and the US, 2/3 of all of our health costs come from three things. Three chronic diseases. And the three things that we can do about it. You know, we can exercise, simple exercise, we can eat well, and emit less carbon. And with those three things, we are actually able to mitigate these diseases. We estimate that if everyone in the US were to walk 30 minutes a day, eat slightly better, and the air was a little cleaner, you could save $1 trillion a year in health costs. That's real. And in Canada's case, it's 1/10 of that, which is still a big number. So how do we do this? And I think the key message I want to leave with you is you see behavior change when people take ownership. Let me just give you some examples of the power of ownership. So once upon a time, people smoked at work. I used to go into big offices and everybody was smoking. And this was particularly true in Europe. We tried all sorts of things, and if you look at packets of cigarettes today, this is what it looks like. But that doesn't work. What really worked was when individuals who weren't smokers found out that they were getting sick. And they took ownership of the air, and now we don't have smoking. You'll see no smoking signs everywhere. Once upon a time, we threw everything out. And in Toronto, I can show you people who earn $1,000 an hour who sort trash. And that's quite amazing. How did we get them to do that? In the old days, I knew my car had a flat tire when it started bumping on the road and making horrible sounds. The modern car is a supercomputer. It has sensors everywhere, and we measure our cars today more than we measure ourselves. It's quite a funny thought. In my car and in yours, we anticipate problems. We don't wait till they get sick. So, for example, mine's a Lexus, an old Lexus, but it tells me that the tires are going flat, and I take ownership of that. If it goes flat, it's my problem. It's not Lexus's problem. So, what if we were to own our own health? Wouldn't that be interesting? So, the key message behind this is when we own the problem, we will solve it. And the question is, how do we get there? And that is true not just of health, but of climate change as well. So let me give you a true story. This is Laurie. She's actually a very amazing person who I met at TED. She was the head of marketing for TBWA, the largest ad agency in the world, and worked like crazy, sat at her desk all day, ate badly, and a few years later, this is what she looked like. And she had diabetes. And she walked into a doctor's office, and the nurse looked at her and said, "Oh, you were diagnosed with diabetes. Oh, we call these people heart attack patients because you're going to come back with a heart attack." So how did she change? And I will post a video up on our website which will allow you to see the full story. But she said to me, and I'm the mathematician, she's not, she said, it's like an equation. My body is doing exactly what I'm telling it to do. It's the way I eat and the way I exercise is what causes my disease. And unless I change that equation, nothing will change. And that's how she eventually took ownership of her own body and has reversed her disease. Quite amazing. So how do we get there? We have three levers. We have infrastructure. We have choice architecture, i.e., do we put salads in front of kids before we put junk food, and behavior. And the two places where we typically don't focus are choice architecture and behavior. What's easy to do, and what we do a lot of, is change infrastructure. So I'm going to talk a lot about the last two. So what we are trying to do here is actually get people to own their own health and take ownership of their own environment. And we do this entirely scientifically with evidence. We rely on evidence. So here's a piece of evidence. Very large study that shows that above all else, simple exercise is the biggest predictor of longevity. So if you want to increase your lifespan, do simple exercise. Example is 30 minutes a day. So what we do is grab all of that data that you now have on your smartwatches, smartphones, whatever, and turn that data into evidence-based change. We use that, and we use science to do that. Ultimately, this is about changing for good. It's about eating better, having better air, taking care of our health and the world's health. So the way we do this is we focus on the human side. Just think of in medicine today, how much human side gets into medicine. We know how to cure people, but very little of medicine really attacks the human side. We rely on stuff that's known. It's behavioral economics, it's social science, and a very simple adage that my daughter told me, she's a psychiatrist. Neurons that fire together wire together. So what's this about? I have some stepdaughters and a young daughter who will not get into a taxi unless the seatbelts. Now, that's not genetic. They learnt that behavior. And if they're wired to use seatbelts, and we are wired to use seatbelts, that wasn't always the case. One of the things that is inherent, actually innate in all kind of behavioral change is rewards. And rewards are not built into our medical system today at all. Some rewards are intrinsic. Yes, I feel better because I took control of my body. But others are extrinsic, and a lot of people are motivated in different ways by intrinsic and extrinsic rewards. So one thing you learn with social science and behavioral economics is that there's no silver bullet for behavior change. It's not a formula. And that's why you'd have to use evidence to segment populations and target very specific change. But we think there might be a silver platform. This is the software platform that we've built. It's just meant to scare you. It's actually a enterprise application that takes all that big data that comes off your smartphones, the gazillions of terabytes of data, and turns that into really interesting information. So the good news is that we've got this perfect storm happening. There are now sensors everywhere. Measuring everything has become easy and cheap, and really getting cheaper, and it's mainstream. I mean, down the road, they are building watches, and time has even picked up on it. So here's a Band-Aid that'll measure how many heartbeats you have per second. And here's a sensor that's going to tell you if you're stressed out. And here's a little band that's going to tell you if you're getting too much sun. And this little box for $300 will sit on next to your bedside and do blood tests for you that you cannot get at your doctor today. This is using nanotechnology. This shirt made in Montreal will measure your heartbeats and publish it to the internet. We would connect to that. Your iPhone is now a glucose meter, and it can tell me whether you are within the right bands that you should be in. And down the road, Google has just filed a patent for the next kind of glucose meter. It's your contact lens. So my real-time pedometer today, when we measure how I walk, is my iPhone. I have a device on my house which tells me, what's happening to my electricity. There's a device in my car that'll tell me if I've been accelerating too much or driving badly, and so on. What we do is now try to model this to change behavior. So an example of that is to look at the world from a human-centric point of view. This is me. I sound like Ratatouille, it's the beginning of the movie. This is me, and these are the brands I interact with. I am interchanging data with these brands all day. And if I could capture that data and organize it and apply analytics to it and somehow be engaged with the people who want to engage me and get rewarded for doing good stuff, I have now got an environment that will help me change. And this is how we can build behavioral change on scale. The big issue with behavioral change is scale. I can get 6 doctors, 4 nurses to work on you enough, and you will change your behavior. But we couldn't do that in a scalable way. And ultimately, this has to be very simple. It's got to be, how do I move the dial from red to green? So let's talk about rewards and why we've invented a new kind of currency, which we call good coins. In the life cycle of a good coin is issued when a social good occurs, that a social good that's been measured. And it's only able to be spent on something that causes a social good. So over the life cycle of this coin, the world gets better. It's a metric for how much good is being created. Now, if the good coin was actually fungible into money, then it would fail, because money can be spent on so-called bad things. Let's take a diabetic. You go into a supermarket, you buy something that's good for diabetes, you get rewarded for it, and on your way out you see a cash register and there are chocolates. You spend your coins on chocolates and the world is no better off. So we've created these coins so that when a good coin is spent and issued, the world actually measurably is better, and you can accrue that measurement. So as we will do in San Mateo County, that could become a metric for how much good is happening here. So let's try and understand this. What we're trying to solve is engaging people to change behavior. Now, there are lots of people who want to engage me. There's my insurance company, pharma, they want me to take my medication. Government wants me to do things, wants me to, ride my bicycle, and so on. Now, we've modeled that by creating this enterprise platform, which then has the glue which you need, which is good coins to reward people. So anything that's measured and calculated can be associated with rewards. And those rewards then can only be spent on good things in our good shop. Now, what's interesting is that if I showed you a slightly different picture, this is my connected home, we all talk about this, the same picture applies. It might be my pool or my thermostat that's talking to me and it wants me to turn it down. If I went to health, it might be my hospital or my Fitbit or my pharmacy that's trying to engage me. Or if it was transportation, it's the county that wants me not to clog up the 101. So you could fill in the dots, but basically what we've created here is leverage. We're leveraging good. The same engagement software, the same rewards currency, the same catalog will work for all of those factors in life. So one of the questions is, who pays for good coins? Well, it's the people who will benefit, or the people who want to make change happen. So, for example, 50% of all prescriptions are not fully filled out. So Big Pharma would love you to fill out your prescriptions, and so would the medical system, because then you'll get healthier. So there's the beneficiary and the benefit, pretty obvious. Government wants me to use less electricity at peak hour. Manufacturers want me to let them know when I would do cold washes or when I do my washing and so on. Why would they pay? Because there's a social arbitrage here. That is, it's cheaper for people to avoid peak energy than it is to build new generators. It's cheaper to nudge people to have better health behavior than it is to fix them afterwards. So imagine good coins for evidence-based exercise, prescription compliance, or healthy behavior, good food, and so on. But the key here is that everything is evidence-based. It's you do good, you get measured, and you get good for doing good. Or you do good for good, i.e. forever. So an example of this is you walk. The world's going to actually be healthier if you walk. You get good coins, and those good coins can be spent on food. So imagine a program like this. You're a Facebook employee. I'm picking on Facebook today. Thank you, Facebook. We at Facebook want you not to be sedentary because we know that sitting is the new smoking. So we're going to reward you for getting up and doing your meetings, walking down that lovely pathway down there. And we'll actually measure that. And if you walk and you get up and you're not sitting all the time, we will give you good coins. Now, you as this Facebook employee could spend those good coins on a gadget in Good Shop, or Facebook will double those good coins if you give it to this NGO in East Palo Alto, who will then reward a young poor person who's, trying to eat and doesn't have enough money to buy food, by getting them to walk 30 minutes to get healthier and then use those good coins that have now been donated by this person to actually get better and to get better food. So we've taken one good coin and it's produced a trail of good in San Mateo. And that's the leverage. It's a different model than I'll give you $1 to this NGO or charity and you spend $1. This is I give you $1 and it turns into $1 million, hopefully. So essentially what Good Coins does is it's the glue in society. It links all good. And there are many examples we can think of. In our case, we do this for saving energy. We do it for compliance with prescriptions and so on. And it's spent on stuff that's good. So here's a tongue-in-cheek logo for our joint venture with the County of San Mateo. So forgive me if I've violated any branding things here, but I showed it to John ahead of time. But we've launched a project with the County of San Mateo, and we are currently looking for partners to actually do this on scale. And when we, back in Canada, think of San Mateo, we think of these beautiful beaches, Half Moon Bay, incredible food, lovely fish that you can get, vistas that make us look sick. It's always sunny. And we think of the 101. So there are a lot of problems in San Mateo, despite all the good that happens here. And truly, you do amazing good. We think this is one of the most amazing places to launch such an initiative because there's so much good happening, but it's just not linked. So, for example, chronic illness is a huge problem. Look at the growth in asthma. It's more than doubled in 10 years. That means that the air is getting worse. Diabetes is almost trebled. And it's growing exponentially. You know why? Because if you look at that 1/3 of the population of kids who are obese, they will have diabetes. And that's why we can predict, just using demographics, that it will grow. But, this is history, and you can look at obesity growth in San Mateo. Now, in other parts of the country, it's actually a lot worse, but that doesn't mean San Mateo should not deal with this problem. We look at the greenhouse gases in San Mateo, and most of it comes from driving. And most of the driving is single people in cars on the 101. Sorry, 101. Active transportation. How many kids here actually walk or drive to school or ride to school on bikes? It's almost none. If you look at the statistic, these are numbers taken from San Mateo Gov website. So here's a little bit of analysis I did. I picked on two parts, San Mateo, the city, and East Palo Alto, the city, and it's actually pretty interesting. There's an index called the Retail Food Environment Index. It's the ratio of, in effect, junk food restaurants to good food restaurants. And in San Mateo, that's 4.3 to 1. That means there's 4.3, sort of fast food, not so healthy places for every one good place. In East Palo Alto, it's 1 to 1. Now, that's a really good ratio. So somehow, that's a lot better. But, you can't, you wonder about this, but these are statistics from your website. Anyway, the number of tobacco stores in San Mateo is actually double that in East Palo Alto. And the number of pedestrian accidents is a little higher in San Mateo, so you'd think there'd be less walking or less incentive to walk. The number of people who drink more than one soda per day, that's, you know, a Coke with 13 teaspoons of sugar, is double in San Mateo than in East Palo Alto than San Mateo. And mortality and obesity is higher in East Palo Alto, but the real killer is mortality in East Palo Alto is 61 years versus 76 years in San Mateo. So this kind of evidence or segmentation really tells us what behavior we want to change and more or less how to get there. So if we look at where would we start, we'd start by looking at, you know, what families eat and where they eat. And this is a map of San Mateo City. Red dots mean fast food, green dots mean good food. We can change this without doing anything very large. For example, we can truck food in to actually compete with the food that's not so good. And we can do that using good coins as the incentive. We can actually make good food, say good organic locally grown food, as cheap or cheaper than bad food with this kind of subsidy. We on our iPhones can easily see, or smartphones can easily see where we can find that food. And there's this wonderful little city in England. I gave this talk in England. And there's a place called Todmorden. And every single empty space in Todmorden has been turned into a growing area. We could make it easier, and I know there are programs to do this, for children to bike to school or walk to school. There would be Google employees, Facebook employees who would gladly volunteer to lead kids to school every day. So I just want to leave you with this kind of thought. It's a very big vision. Imagine good coins as the currency of good, and that every single act of good in San Mateo was linked and leveraged in this way, and that employees in places like Facebook and others who are well off could actually find ways to make the good that they want to happen across the county using these kind of coins. And that ultimately we will take ownership of our air, our health, and our transportation. Thank you. It looks like I still have more time, so if there are any questions, I'm happy to answer them. Yeah.
Sorry, I walked in a couple minutes late, so I might have missed you explaining this. Is this a nonprofit, or how is this structured as a organization?
This is structured as a social enterprise, a for-profit social enterprise. And the main reason for doing that is really to create sustainability. When we reach a certain critical mass of people using good coins, it becomes self-funding. Any more? Yep.
Hi, Brian Simmons from the San Mateo County Office of Education. And I was wondering there's a lot of obvious, I think, educational implications that you didn't talk about, and I'm wondering about that. So how would it be applied to schools?
Actually, it's a very good question. Thanks for asking it. I forgot to mention that our very first partner in San Mateo is PG&E, and we'll launch a school project here in January. It's around educating children on energy management and how to. So there's a huge educational component. Essentially, the children will be taught where energy comes from, where it's used. They will be trained to switch off non-necessary appliances in their schools when they are reaching a certain target on energy usage at peak hour, and so on. So, and we hope they'll take that back to their homes. That's funded by PG&E. Yep.
Jeff Alfs, Portola Valley. How is pricing handled? Is it some combination of market and a policy setting?
Are you talking about pricing of good coins?
Yes.
Ultimately, you know, it's a very good question, because ultimately it's what is 30 minutes a day worth to you versus worth to, I don't know, Palo Alto City. Ultimately, we believe that that number will settle down. But in an early market, any early market, there's a lot of inefficiencies. So it's essentially pricing is what people will be prepared to pay. So if I'm some big corporation here and I want to incent you not to be sedentary, I might be prepared to pay, you know, twice as much as the corporation down the road for that same thing. So it's the way the good coins themselves are valued nominally at something like a cent a coin. Yeah, we're actually part of a very large initiative in Canada, which is run by Public Health. We're one of the finalists in a competition that the Public Health is running. And that is to deal with childhood obesity. And the idea is to get kids to play more. And how do you incent them to play more? It sounds funny, but you know, today kids go off to and play on their computers more rather than play outside more. So this is a very big issue. There's about 30% of all Canadian kids are obese. It's not very different from here. And it's a huge initiative. So the answer is yes, we are working on that. Oh, are we out of time? Okay, we're out of time. Thank you.
Two reminders. Don't forget to like us at lunch if you haven't already. And second, the Facebook staff will be on the sort of the mezzanine and willing to do individualized looks at your Facebook page and offer any coaching or any insights. So take advantage of them. Okay, we can have lunch.
Think less but see it grow like a ride, like a ride.
If we could have your attention. We certainly hope everybody enjoyed their lunch and networking opportunity. We are going to begin the second portion of the day with a very special award presentation. When Warren Slocum and I were discussing our vision for Connect 13 last year, we both saw the need to recognize individuals and organizations that are making a difference in government through the use of technology. As we've already discussed, the technology is all around us. It's what we do with it that matters. We are looking for individuals and organizations that have not only embraced technology, but have used the technology to improve how government functions. How is technology allowing government to be more responsive, to better address constituent needs? How have services been elevated in your communities? We're looking for vision and leadership, and equally important, results. We're looking for those that have set the standard in San Mateo County. I think our selection of Chief J.R. Gamez and the Redwood City Police Department fit that description. I'll turn it over to Warren to talk more specifically about our honoree.
Thank you, Kevin. Hashtag give it up for Warren Slocum. All right, come on. So, more than 140 characters, JR. Okay, so how was lunch? Lunch was good? Everybody got something to eat? Good, right on. So Chief J.R. Gomez and the Redwood City Police Department use social media, as many of you know, creatively and throughout the organization to connect and protect the citizens of Redwood City. And since I'm a Redwood City resident, I appreciate the chief's leadership. Thank you. The police department's journey began in 2009 with a Twitter account and a group of staff members from different parts of the organization who were willing to work on the project. And today, their Twitter account, which Kevin and I are very jealous about, has nearly 6,000 followers. And they use the tool to live tweet from town hall. I know they've had ride-alongs, and they're really, really creative. After the Twitter site was established, they added a Facebook page to showcase the department's initiative. And one of the things that's very cool is they were one, I think, the only one that I know about, and Chief could correct me, but to put their Facebook page in Spanish. Last year, the Redwood City, yeah, give it up. That's good. And so the story goes on and on. They've done all these very, very creative things. But the thing that really impressed me was when I heard the chief speak at last year's, or was it this year's? I can't remember, this year's conference in Monterey, the Progress Seminar, where in that session he talked about how setting up a Pinterest site had led to the solving of a robbery of jewelry, I think it was, that had occurred some 20 years before. And through that site, I guess the family of the woman whose jewelry was stolen had a chance to look at that and said, hey, that looks like my whatever, and contacted the department, and she was actually reunited 20 years later, right? Almost 30 years later with her jewelry. How about that? So, you know, not that Redwood City has any serious crime, but for more serious crimes, they actually have been using the internet and IP addresses and some secret things that I can't tell you about to help solve those kind of crimes. So it's quite obvious to Kevin and I that the chief and the Redwood City Police Department, and as well as Bob Bell, the city manager, and of course Roseanne, vice mayor, and the mayor, Jeff G., and the rest of the council's leadership have really taken this to a new level, have become, I think, a model for police departments in not only California, but in the nation. So with that, if you'll come up, Chief. Congratulations. And I'm assuming that in the black box is the award. Oh, isn't that beautiful? How about that, ladies and gentlemen? So on behalf of us all at Connect 14, and especially from Kevin and I, we'd like to present you and the Redwood City Police Department with this Civic Engagement Innovator Award at the second Connect conference, and best wishes for every success in the future.
Thank you so much.
And I know this wasn't scripted, but maybe you could say just a few words.
More than happy.
Well, wait, are we on schedule? Oh, we're okay. You can say
Okay.
the words.
Thank you. Thank you very much. Thanks again. I don't want to break this here. That'd be kind of embarrassing.
Well, thank you. Thank you both for honoring us with this award, and thank you for putting on this great conference at the home of social media, as far as I'm concerned. My job is very easy, and I say that is because I have a very supportive council and a great boss. Dr. Robert Bell actually has his department heads. He encourages creativity and innovation. So it's with that mission, you know, it's easy to kind of do your job. The other part of it is for us, the utilization of social media is it's a great tool. There's so many platforms that are out there, as all of you are very well aware of. But for us, it's how are you going to utilize all those platforms into your vision? And definitely for the last 3 years, what we've been trying to do is just really create better, or what we call exceptional, customer service to the residents of Redwood City. And the best way of doing that is by effectively communicating. Social media allows us to do that, and picking those right platforms to deliver that message has been something that we're working on consistently. For a department of only 125 people, we actually have 10 folks that are assigned to our social media team. So since we are a 24/7 operation, we provide them, obviously with some policies and procedures in there, the ability and the creativity to go ahead and communicate the information that our residents need to know. So with that, it's an ongoing mission. We really enjoy what we're doing, and again, thank you both for honoring us on this. Thank you.